Hi, I'm Dr. Mihir Wagh. I'm an associate professor at the University of Colorado in the interventional endoscopy section. I have with me Dr. Chetan Mittal, and we'll be discussing with you today findings from our study which is being published in GIE in the upcoming months. Chetan?
So I'm a senior gastroenterology fellow at the University of Colorado, and I'm glad to be here to discuss the study results and findings.
Perfect. So I think for our audience, maybe we can start by discussing what exactly is this microforceps and how it's used.
So microforceps is essentially a novel diagnostic tool, which is a small caliber forceps that can be easily passed through a 19-gauge EUS needle to obtain biopsies from the pancreatic cyst wall. So currently we rely on CEA, EUS findings, and cyst fluid cytology to make a diagnosis of pancreatic cyst, which are not perfect. Therefore, we performed a study which is being published in the next issue of GIE titled Technical Feasibility, Diagnostic Yield, and Safety of Microforceps Biopsies during EUS evaluation of pancreatic cyst lesions.
So let's also now talk about the main findings of this study and what this study adds to what we already know about EUS evaluation of pancreatic cysts.
With this pilot study, we show that microforceps biopsies are safe and associated with a high diagnostic yield in the evaluation of pancreatic cysts. There were some cases where microforceps biopsies were diagnostic, where a diagnosis could not be achieved with the other modalities. However, on the flip side, fluid cytology achieved a diagnosis which was missed by microforceps biopsies. Hence, these microforceps biopsies should only be used in conjunction with other modalities of pancreatic cyst evaluation, including EUS, CEA levels, and fluid cytology.
So as you said, the cysts were analyzed using all these modalities in our study. And what we did not look into is some of the time factor and cost associated with doing this extra step. So any thoughts about that?
So at this point, we do not know the true cost of microforceps biopsies, but it definitely adds procedure time. It would be important for future studies to evaluate that further and determine if adding microforceps biopsies is eventually cost effective by changing surveillance intervals and providing a true histologic diagnosis, which may change management dramatically.
Right. So maybe we should talk to our listeners about the next steps, the next logical steps now that we've done the initial pilot study, what we should be thinking of to assess these forceps further.
Larger prospective studies should be performed next to determine the true diagnostic yield and safety of microforceps biopsies. Randomized trials comparing cytology and CEA with and without microforceps biopsies should be performed to determine the true additional value of adding microforceps biopsies to the evaluation of pancreatic cystic lesions.
Right, and this would also include the time component that would be needed, additional time that would be needed to do the microforceps biopsies, and even look at the cost analysis that this would require. So thank you for listening. We encourage you to read our paper in the upcoming issue of GIE. If you have any questions, comments, suggestions, feel free to reach out to us. And once again, thanks for your attention.
Thank you.